welcome to another episode of the Bay Area Mental Health Hour. I'm the executive producer and host, Alicia Mayo. Thank you so much for joining us. I'm joined tonight by our clinical psychologist. He's our resident doctor here, Dr. Jason Outlaw. Thanks for joining me again, Dr. Outlaw, for another conversation.
Thanks for having me. I'm always excited when we get a chance to record and share some information with the people out there. As we've mentioned lately, within the COVID-19 world, this has given us just an opportunity to share in a space where information is, of course, valuable. And I'm certainly excited to talk today.
Yeah, we're still in COVID-19 coronavirus pandemic season. It feels like it's been a whole season already. I'm looking forward to the time when we can all get out and get together again. But in the meantime, we should still continue to practice our social distancing and washing our hands and wearing the protective mask in public places and all of that until the governor, gives us the A-OK to go about our normal daily lives as normal as we can go about it under the circumstances. So considering, the stress that, many of us are still feeling, I have to admit that I have had my own kind of ways of coping here lately. And one of those things is by snacking. I've been snacking a whole lot more than I normally do. And my favorite is that bourbon ice cream. It's no bourbon inside of it, but it's the Häagen-Dazs bourbon flavored ice cream. I think I have, become kind of dependent on it to kind of just make me feel good in those moments. I'm not eating a lot of it, but I'm eating enough of it to where I know that it is becoming something that I'm kind of leaning on and dependent on to kind of lift my spirits every now and then. And I mean, considering everything we're going through, people are leaning on different things, ways of coping, including, food addictions and other addictions. Some of us have tried marijuana for the first time, not myself, but some other folks have had some deliveries made. I've heard a few friends talking about that. Those marijuana delivery services actually have increased their memberships and services. And it just, got me to thinking about this whole idea of, ways of coping and substances that we're all using, whether it be food or, mild to moderate to severe narcotics. So let's talk a little bit about substance abuse. What are the origins of substance abuse in your opinion? And, how does it begin for someone? I know for me, it began under stress,
Sure. So people tend to, and I guess let's start off with just the concept of understanding coping strategies. So when you or we are under stress and we are attempting to return to previous level of functioning, there's lots of things that we can do that will help us or potentially help us return to previous level of functioning. And so that can be something as simple as going to the gym. It can be, reconnecting with old family members. It can be forgiving people who have harmed you in the past. It can be lots of different things. But you have to understand that we have to separate coping strategies dichotomously into healthy coping strategies and not so healthy coping strategies. But they both count as coping strategies. So that's like the interesting part of even substance usage is it might actually work, right? It might actually serve to reduce one's stress level, to help one get beyond previous childhood abuse or neglect. Certainly substances can do a lot of things that actually have a certain level of arguably good to them. And I guess the other part is you have to understand that there are prescribed medications and medications that are prescribed. We in our society have accepted them, and they certainly count as, people count them as healthy coping strategies and healthy ways of dealing with whatever ailment that you have. And then you also have the things that are kind of street sort of drugs and They're narcotics that, of course, are banned and illegal no matter where you go. But all in all, I do want to just make sure that we understand that there are ways of coping that can be helpful and hurtful, and can hurt you as well. And it's not always a clear line between the two of them, and sometimes people use them in two things together. So you might use promiscuity along with alcohol, and that combination might be helpful for some people. Once again, we have to look at whether these things are helping or hurting in a way. But to answer your question, the origins of substance usage kind of really came based on people dealing with certain ailments and certain categories of mental illness in a way that they noticed that, oh, in addition to me treating this condition, this is also helping me deal with my anxiety, right? And so when you notice that a side effect is somehow helping, of course, the pharmaceutical companies at times then start to prescribe it for that reason. I believe that erectile dysfunctioning medication was used for that same, or excuse me, it came about in that same sort of way. I don't remember exactly what it was prescribed for initially. I think it may have been like
sleep disorder or something like that.
Something of that nature. But they noticed that males got an erection when they would use that medication. So now they're prescribing it for that particular purpose. So
and losing sleep.
There you go. So we have to be careful when it comes to substance usage. And I guess let me paint this picture as well. There's a difference between substance use, abuse, and dependence. And it's kind of more a continuum, right? So an individual can use a substance and not necessarily experience any negative effects. Maybe it was an experimentation phase, they use it and they're going about their life. Of course, the second level of it with abuse, that tends to come with the diagnosable condition, and you might have legal problems, you might have lost certain friends, maybe your family has staged an intervention, maybe you've noticed a certain level of other side effects and how it's affected you, maybe you're gaining weight, maybe you're losing sleep. There's a predictable amount of side effects, or effects, I should say, that happen along with it for it to qualify as abuse. And then dependence is like kind of the end of the spectrum, where an individual not only has suffered the effects of abuse, but there's also physiological sort of dependence. So a person might experience withdrawal symptoms, or they might also need a higher amount or a larger amount of the substance to achieve that same desired sort of effect, right? And so if someone were to smoke marijuana, for example, and in their beginning stages of usage, all they needed was a little bit. But after years of usage, now you might need a lot more of that to achieve that same desired sort of effect. So it is important for us to understand that usage alone doesn't necessarily mean that we have a problem, but we can certainly look at certain behaviors and effects, and it can, of course, go all the way to dependence.
And looking at certain personalities, who becomes addicted? Who are these people who are more likely to become addicted?
Yeah.
Do you have?
Well, there are certain different theories, and this is something that we don't completely understand totally. A lot of people will assume that people who become addicted to substances are just people who are weaker individuals, people who are less likely to be able to discipline themselves to avoid certain things or to engage in certain things. And that's largely a myth. Like
okay.
No matter how strong or not strong you are, it doesn't mean that that is going to predict with high accuracy whether you'll become addicted and dependent upon a substance or not.
We hope you enjoyed this episode of the Bay Area Mental Health Hour. Please visit our YouTube channel today, subscribe, and click on the notifications bell so that you can receive updates on our latest episodes. This conversation on substance abuse and therapy will continue. If you or someone you know is in crisis, help is available at the Substance Abuse and Mental Illness Helpline at 1-800-950-6264. Or call the National Suicide Prevention Lifeline at 1-800-273-8255. Your support makes it possible for us to produce content like this. Thank you.